Weight gain. Gaining weight during pregnancy is normal. But the added weight can press on the throat, making it harder to breathe during sleep, leading to snoring. Hormonal shifts. Pregnancy brings changes in hormones. This can cause the nasal passages to swell and reduce the space for air. Result? More snoring. Increased blood flow. When pregnant, a woman's blood volume grows by almost half. This can make the nose more congested, making breathing a bit tough, especially when lying down. Snoring during pregnancy is a common experience, a sign of the body's amazing journey to support new life. If it concerns you, always consult a doctor. Remember, your well-being matters for both you and your baby.